Thank you for pulling up to this mini, hopefully informative, presentation on clinical exercise physiology, multiple sclerosis, or MS. My name is Kais Alizada. Just an FYI, this presentation is designed for professional groups, but if anyone wants to dive into this topic and finds parts that are unclear or slightly confusing, feel free to comment with any questions or concerns. Okay, so what is MS? Multiple sclerosis is a potentially disabling disease of the brain and spinal cord. One's immune system protects one's body from outside invaders. These include germs like bacteria, toxins, and viruses, for example. However, in MS, the immune system attacks the myelin sheath instead of toxins or viruses. So, since the myelin protects and covers nerve fibers, and because the myelin is damaged, this exposes the nerve fibers, which in turn results in communication problems between the brain and the rest of the body. MS can result in significant mental and physical symptoms, such as muscle weakness, abnormal walking mechanics, balance problems, spasticity, fatigue, cognitive impairment, and depression. So how prevalent is it? Nearly 1 million people are living with MS in the United States, according to a study funded by the National MS Society. Keep in mind this is just in the US. But still, this is more than twice the original estimate, and this translates to we need solutions for MS now more than ever. Why focus on multiple sclerosis? As a future clinician, the goal is to be able to treat, encourage, and support anybody that steps into the clinic. However, with regard to special populations, I think it's critical to understand that your standard doctor flow or doctor protocol may need some alteration. In some cases, you may be able to recommend and provide exercise guidance in the same way you do for your typical patient. However, in other cases, it may be better to address them in a manner that's more mindful of their unique characteristics. Additionally, I focused on this disease because it can have an immense impact on the patient's quality of life as well as anyone close to them, like a partner, parents, siblings, or friends. Unfortunately, there is no cure for MS. However, treatments can help speed recovery from attacks, modify the course of the disease, and manage symptoms. Right, so clinical exercise and MS. Halabji et al., forgive me if I mispronounced the name, the scientists explored exercise prescription for patients with MS, the potential benefits, and the practical recommendations. MS patients typically do less physical activity because they fear worsening their symptoms. With this, a couple questions can be, how do you get someone to step out of their comfort zone? How do you tell someone who fears exercise to exercise? Thinking critically here, perhaps they don't fear exercise, but they fear worsening their symptoms or falling down because getting hurt is what's scary. A unique challenge when dealing with MS patients would be taking their balance problems into consideration because balance is such a critical component to many exercises. For instance, if they're having extreme balance problems, one cannot simply tell them to do box training or shuttle drills. Instead, Tai Chi exercises with slow, eccentric movements may be beneficial to maintain balance, strength, and range of motion. Along with balance concerns, an important aspect to consider is their greater risk of falling. If an individual with MS does not have the stability or strength to take part on land activities, coordination and balance drills may be done in shallow pools. With this environmental change, the risk of falling or injury due to balance loss is minimized, and the support of water would help the individual accomplish difficult movements. In the science world, it's pretty well known that balance and gait deficits are common in people with MS. Calron et al. Listed some of the disabling deficits of MS, such as reduced mobility, independence, increased likelihood of falls and injuries, and negatively impacting the quality of life. They pointed out studies that have already dived into several forms of exercise and their influence on walking and balance, but a lack of scientific evidence supports a Pilates program's effectiveness on MS patients. This led to the primary goal of their randomized controlled study, to examine the effects of a 12-week Pilates exercise training program on gait and balance in people with MS and compare these results to those of a standard physical therapy intervention program. Both the Pilates program and physical therapy program comprised of 12 half-hour individual face-to-face training sessions delivered over 12 weeks, plus an individualized 15-minute daily home exercise program. Clinical gait and balance tests included the Time Up and Go test, 2 and 6 minute walk test, functional reach test, Berg balance scale, and 4 square step test. Data analysis was performed using IBM SPSS statistics software, which examined for normality violations, outliers, errors, and missing values. The groups were compared at baseline using the t-test for independent samples for continuous variables and the chi-square test for categorical data. All outcome variables showed normal distribution. Therefore, the authors chose the repeated measure ANOVAs with the between subject factor at 2 levels, the Pilates group versus the physical therapy group, and a within subject factor at 2 levels, the time, pre-intervention, and post-intervention period. At the end of the study, both groups had significantly increased their walking speed, p equals 0.021, and mean step length, p equals 0.023. This reinforces that the patients felt more confident taking bigger steps. The authors concluded that this study presents an alternative rehab program for people with MS. Practically speaking, this is huge because learning about new methods of helping MS patients can be life-changing. It paves the way for more studies incorporating Pilates training and its benefits. My favorite result of the study is that both groups improved. Executing the Pilates approach did not have any significant advantage over the standardized physical therapy group, but it shows that movement and exercise can result in amazing positive outcomes. Kim et al. Analyzed numerous relatable studies and drew important highlights. The literature they summarized consistently indicated that moderate intensity aerobic training should be performed 2 to 3 days per week in 10 to 40-minute bouts. By achieving these guidelines, people with MS can potentially improve their cardiovascular fitness, mobility, and symptoms of fatigue and depression. This should be complemented by 2 to 3 days of weekly resistance training, from which anticipated benefits could include improved strength, balance, mobility, performance of activities of daily living, and symptoms of fatigue. So, conclusions and future research. There's been a steadily increasing body of research on the outcomes of exercise among persons with MS, and this has accelerated sharply over the past decade. Even though there's been progress, it's important to understand that this doesn't mean the work is done. With this being said, exercise should be considered as a safe and effective means of rehab in MS patients. Existing evidence has shown that a supervised and individualized exercise program can improve physical fitness, functional capacity, quality of life, and modifiable impairments in MS patients. And in this last slide, a list of references I used throughout the presentation.